The building is one thing, it's something that catches your eye, but the important thing is what goes on in the building.
When you walk through the doors, I mean, it's kid-friendly. We got color on the walls, everything's decorated, and the biggest thing I think you notice is the smiling faces of everyone around you.
Everybody that works here, from the doctors, the nurses, and every staff member, their sole purpose of being here is to take care of kids and to make sure that these kids get the best possible care and have the best possible outcomes.
We love coming to work each day. This isn't just a job for us. Just the compassion that everyone has here is indescribable.
Children's is the best place for kids because everybody's here for the right reason, and that is these kids. We are 100% devoted and dedicated to children.
Each day I wake up with a smile on my face knowing that I'm going to take care of babies and take care of the families and just provide them with excellent care that our doctors and our subspecialists can provide every day.
Anybody who works with kids can tell you they're absolutely unbelievable. They're resilient, they're tough, they're stronger than anybody ever gives them credit for.
One of the tremendous advantages that a pediatric hospital like Children's has is its ability to care for patients who are 1 pound and patients who are 200 pounds, with conditions that are life-threatening and conditions that are more chronic disease and not acutely life-threatening.
We also have equipment that is specific to the child's size. So we have equipment for infants all the way up to adolescents.
We're the only pediatric critical care team there is. We are a mobile ICU. Many times the outlying facilities and parents also, when they see us, do breathe a sigh of relief because they know that we're the best at what we do and we can get their patient, their child, to a place that they know is the best place for their child.
We would go all across the state of Nebraska. We get to see the children in their own communities, and we get to visit with the physicians that are caring for these children, and it's a wonderful experience for all of us to do these outreach clinics.
We all have the same goal in mind, and that is to take the best care possible of the children and the families that we see each and every day.
Pharmacists are a very integrated part of the medical team. We're up there on the floors every day, rounding with the doctors, rounding with the nurses, with the specialists. So we're up there to work with the physicians and decide what is the best dose we can give this kid, how should we monitor this drug therapy.
The neonatal intensive care unit is special because not only does it involve neonatologists, social workers, respiratory therapists, and very experienced nurses and nurse practitioners, but it also includes every other single pediatric subspecialty available, from genetics teams to heart surgeons to cardiologists. Everything is available here, and you don't have that in any other NICU in the region.
As a pediatric radiologist, we specialize in pediatric diagnoses and pediatric problems, so I feel like we're the most qualified in the region to take care of kids and try to help the other clinicians in the other specialties find an answer.
I think it makes it a more kid-friendly environment. It's not as scary. They don't see all of the, scary equipment all around. They also have friendly things to look at, like their artwork. And the kids, if we're taking them down for x-ray or taking them down to go to the OR, they can look up and see a friendly thing to look at.
I think at Children's it's our responsibility to try to find a way every single day to make it as good a day for the families and for the kids as we can. Maybe that's just saying hi to somebody in the halls. Maybe it's giving a child a hug or encouragement, or maybe it goes as deep as having a long conversation with a family about where we are in treatment and what's to expect next.
We can help people and understand what is the process, not only because we provide the language translation, it's also because we provide the meaning of those words that in the medical terms they do not understand. I think that is a big difference there.
People on our teams are just really personally invested in the outcome for each child. And when a child's doing well, we're proud, I'm proud. And when they're struggling, I'm struggling too.
It takes a unique skill, it takes unique training, it takes unique personality, and it takes unique insight to be able to do high-quality pediatric cardiac surgery like we do here.
and to just leave at the end of the day and know that you made a difference in that child's life and that family's life is just amazing.
There's nothing better than the privilege of taking care of a child.
You see them get better and you see, you know, the tubes come out and the tape comes off and you get to see their face and their little smiles, and you know, you see them without all the medical stuff going on, and you're like, that's what it's about. That's what makes it worthwhile.
We are all about kids. It is what we are. It is our focus. It's what we do each and every day. And it is our sole mission, is to provide quality health care for children.